You know, when I went to medical school, we talked about the molecules in food.
Right.
We really didn't talk about the entity of food, but we talked about the molecules.
Right.
And the molecules in the body that interacted with the molecules in the food. But we certainly didn't talk about how the food was prepared or the art of it. So there's been an evolution in some way in that direction to now an awareness of the need for this kind of understanding, if not training.
So we do episodic care, we do interventional care really, really, really well in the last 50 years. We've gotten fantastic at it. The challenge is that in that same period of time, there's been a concomitant rise in calorie-dense, nutrient-poor, relatively easily accessible food that is causing illness, that causes probably 70% of the patients who sit down in the examination room are there because of a food-related illness. So we just, we need to make this part of our toolbox now, where we've never really had to think about that as much before. Well, I think the idea of teaching healthcare professionals to cook is a really sound idea. And we have data that shows that it makes better prepared students, that it makes healthier students. There is some data that says, as physicians, if we walk the walk ourselves, and then we talk the talk about the walk that we walk, our patients listen to us at a higher rate, especially if we share that personal, experience. And so a lot of the concept around teaching healthcare professionals to cook is a bit of a hook, to here's the skill set that everybody should have. They should be able to, cook for themselves, read a recipe, parse a recipe, build a weekly shopping list, build a menu for the week, go grocery shopping, plan for leftovers so you don't have to cook all the time, and then go home and cook for themselves. So there's that kind of skill set that if we know about that ourselves, we're able to relate that better to our patients, what might work for them in a shared decision-making environment, right? Using really great, well-established motivational interviewing techniques that help us get our patients to a healthier diet, healthier consumption habits. And the nice thing about the culinary medicine programming is you do that hands-on cooking piece together in teams, right? So it's team-based learning, but it also incorporates case-based learning, which is how we should learn. I think that we shouldn't be doing that in silos. I think that if you've got 16, 20 students in a teaching kitchen and they're learning these concepts, some of those should be nurses, physicians, pharmacists, PAs. We should be trying to create interprofessional and interdisciplinary programming because, again, food is our shared experience, and it's a way for us as healthcare professionals to connect with each other at a much deeper level than we ever have before.